I'm honored now to introduce our keynote speaker and 2007 AUC graduate, Dr. Angela Branche. Dr. Branche is currently the Clinical Director of the National Institutes of Health Centers for Excellence for Influenza Research and Surveillance at the New York Influenza Center for Excellence. She is the co-principal investigator for the University of Rochester Vaccine Treatment and Evaluation Unit. Her current research activities explore the clinical disease, pathogenesis, development of therapeutics, and vaccine biology related to infection with viral and bacterial respiratory pathogens. As a leading infectious disease specialist, Dr. Branche is actively involved in efforts against COVID-19 pandemic in her home state of New York. Dr. Branche, we welcome you as an outstanding alumna of AUC. Please join me in welcoming Dr. Branche.
Good afternoon, class of 2020. Let me start by wishing you my heartfelt congratulations on this culmination of all your years of hard work and dedication. I hope you're as excited about this next step in your career as I was when I sat in your seats 12 years ago. I was thinking back to that moment and trying to remember who the keynote speaker was at our commencement ceremony, and I'm ashamed to say I don't remember who spoke, and I don't remember anything that was said. So I won't be at all offended if my speech today is equally as forgettable to you. I think I was just taking in the experience and overwhelmed at finally attaining this elusive lifelong dream. It was a magical moment for me, and even though this celebration might look and feel differently than you and your loved ones had imagined, it should in no way diminish your accomplishment and the joy you should feel at having achieved your dreams. As I was preparing to write this speech, I started to think about what I would have wanted to hear when I was where you are now, and two things came to mind. I would have wanted to ask the speaker, who I'm sure would have been introduced as someone very accomplished who went on to great achievements in their field, what it took to get to that place of achievement, and how AUC and an international medical education helped position him or her for success. So let me start by telling you about my journey. I'm from an immigrant family. I'm proud of that. We immigrated to the United States from a small country called Guyana in 1987. My parents are hardworking, incredibly intelligent, loving, and God-fearing people. They raised me and my siblings really well and sacrificed a lot to give us every opportunity. I'm the oldest of three, so it was really important for me to set a good example. My father wanted to be a physician, but deferred that dream to provide for our family. He did pass the dream on to me, and I can honestly say I can't remember a time in my life when I didn't want to be a doctor. I was very cognizant of the sacrifice my parents made for us and worked really hard in high school, where I excelled and earned acceptance to an Ivy League university. I did well enough in university to be granted early acceptance to medical school here in the US in my senior year. However, two things happened that fall of my senior year. On September 11th, 2001, two planes were deliberately crashed into the Twin Towers of the World Trade Center. When Building 2 collapsed, and for 2 hours afterwards, I thought my mom had died. She didn't, but that led to a second important event that fall. I lost that single-minded focus I had and encountered my first failure, my nemesis, my eternal nemesis, biochemistry. That led to my acceptance being rescinded and 2 years of trying to be stronger and more mature than I knew how to be. It was my dad who suggested applying to AUC and who taught me that failure is just a bend in the road, not the end of the journey. I made it through my 4 years at AUC, which was an amazing journey with so many hard and so many beautiful moments, like studying on the beach till sunset. I went on to do residency in Brooklyn, and let me tell you, for those of you who are embarking on residency in New York City, it's not for the faint of heart. I can remember being so tired and stressed that I would cry as I walked home from the hospital at 11 o'clock in the night. But I so loved being a doctor, getting to do what I dreamed of all my life. It was enough. It was more than enough. In my third year of internal medicine, a really arrogant male resident colleague told me it was good I wasn't going to apply for fellowship because that would leave me more time to take care of a family. It made me boiling mad, but I'm actually really glad he said that because it challenged me to really think about what I was capable of and what I wanted to achieve. I was named Resident of the Year that year, by the way, an honor he had wanted for himself. And I wanted to take this moment to encourage all my female colleagues in the audience, including the new female graduates. You can thrive in this field. There's space in medicine for you. I already knew I was a good physician, but I had let contentment in having achieved one dream stifle me from exploring other possibilities. I chose infectious diseases because all the great thinkers I had met in my training were infectious disease physicians, and I wanted to approach medicine that way. At the University of Rochester, I discovered I didn't just want to practice medicine, I wanted to invent and contribute to the knowledge that defines evidence-based practice. So now I have this amazing career where I work at a large academic university and I get to practice medicine at the highest and most challenging level. I teach fellows and residents and lecture at the medical school. I contribute to the science of medicine with research. I'm on the phone with the NIH at least once a week. I've been invited all over the world to share my research and my expertise. The audience is made up of thousands of people. And most importantly, I know what I do really matters. Sometimes I'm sitting in my office and I think about the trajectory of my career, and I can't believe everything that's happened. It's so much more than I ever could have imagined for myself. So let's go back to my original premise of this speech. What did it take to get to a place of achievement? And how did AUC prepare me for that? I named this speech Sanity and Serendipity because the answer to the first question is both of those things. I had great parents who supported me every step of the way. I put my trust in a God who redeemed every mistake and failure and restored my dreams. And I was passionate every step of the way about becoming a doctor. I've heard that the definition of insanity is doing the same thing over and over again and expecting a different result. If that's true, we're all pretty insane. But I think passionately pursuing medicine despite failure after failure is my definition of sanity. You don't give up on your dreams. There's also a lot of serendipity in how things turn out. Don't for 1 minute believe that because your path is not traditional that it can't be amazing. There are things that you can do to help yourself succeed. Work hard, read a lot, pick a good mentor. That's so important, the most important thing I did. Ask questions and engage in all your training experiences. But there's so much more that you can plan, and my advice is that every stage of your training and career, pause and ask yourself if there's more that you are capable of achieving, and leave yourself open to new possibilities and new directions. I'm going to end by answering the second question, how AUC and an international medical education positioned me for success. I'm going to be truthful in this moment. There is a stigma attached to training at a Caribbean medical school. But I can promise you that when you're on night float in August of your intern year and someone is crashing and the nurse turns to you and says, "Doctor, what would you like to do?" you're going to realize that AUC gave you everything you needed to succeed. And that the only thing that matters in that moment is how seriously you took your training. But I have sat around the dinner table with very accomplished colleagues from really impressive academic institutions who have very long pedigrees. And when I tell them that I graduated from AUC, they don't quite know what to think and find it hard to hide their surprise. Every time I give a presentation, my credentials are listed, including when I went to medical school. But if the stigma has been an obstacle, I can honestly say I didn't notice it. And more importantly, It never stopped me, and it doesn't have to impede your achievements either. Your experience at AUC has required grit and determination, and that builds character and will contribute to your success as a physician and as a human being. Work hard, class of 2020. Make the most of every opportunity. Be fearless in exploring new possibilities and considering new directions for your careers. Read all the time, because knowledge will set you apart from your other colleagues. Congratulations on having passionately pursued medicine. You all deserve to have amazing careers, and I sincerely hope that you go out there and take it.
Dr. Golden Jackson is the Assistant Dean for Community Engagement at AUC and an Associate Professor of Social Sciences. She works with the local St. Martin government, community groups, students, and faculty to support the design and implementation of projects that contribute immensely to the community priorities in student learning. Dr. Jackson leads 2 marquee activities for our university each semester, the Community Action Day and Project Health, a public health program supported by the St. Martin Ministry of Health. She will now announce the recipients of the Excellence in Community and University Service Awards. Dr. Jackson.
Congratulations to all the graduates and their families. This is your day and a great day for AUC. I have the honor of announcing 4 recipients of the Excellence in Community and University Service Award. AUC presents this award to recognize and celebrate exemplary records of community engagement and contributions to students and the university. Selection of the award recipients is based on essays describing individual community engagement. More importantly, the essays focus on the learning from the experience, the impact of community engagement on professional and personal development. We want to acknowledge all who took the time to reflect on their community experience in medical school and the ways the experience has shaped their development as a person and a physician. The first recipient is Dr. Sobi El-Hayek. Dr. El-Hayek will begin an internal medicine residency at the White River Health System in Arkansas. Dr. El-Hayek was a leader in the Student Government Association throughout his 4 years at AUC. He approached this work with an aim to enhance the student voice and support the partnership between the students and the university. He identified the well-being and mental health as an essential topic to be discussed and supported at AUC. He was a founding member of Thrive, a group formed to promote well-being and combat burnout. Dr. Hayek engaged with the St. Martin community in a lasting and meaningful way through development of training scenarios for an island emergency response course. Dr. El-Hayek summed up his record of engagement in this way. Through my service at AUC, I have gained a passion for supporting others. And I know that I will not shy away from advocating for better well-being during my future career in medicine. Congratulations, Dr. Sobi El-Hayek. The next award is presented to Dr. Andrea Batchen. Dr. Batchen will start a pediatrics residency at the Ascension St. John Hospital in Michigan. Dr. Batchen has a focused and impressive record of engagement with AUC and St. Martin communities. At AUC, she was an anatomy TA and a member and president of the American Medical Women's Association. During her presidency, AMWA facilitated opportunities to meet women in practice who provided perspective and advice to future physicians. Dr. Batchen linked her work in AMWA to the St. Martin community, forging a strong relationship with Safe Haven, the domestic violence shelter. She wrote about her experience. Safe Haven taught me to always listen first, to empathize, and to educate myself on the laws and imbalances of every community I work in. Throughout every case, I always saw the ability of women to find strength and protect their children despite the current circumstance. Dr. Batchen graduates today from AUC with this goal. As a future pediatrician, I hope to inspire young women to achieve their goals through hard work and perseverance, no matter the obstacle. I'm committed to provide as much inspiration to others as I have felt during my 4 years of training. Congratulations, Dr. Andrea Batchen. The third award is presented to Dr. Konstantin Kanakis. Dr. Kanakis will start a pathology residency at Loyola University Medical Center in Chicago. At AUC, Dr. Kanakis was co-president of AMSA and provided leadership for developing a bone marrow registry. In the clinical years, he served as clinical student representative and returned to St. Martin to participate in the first TEDx event. One word captures Dr. Kanakis' record of community engagement on St. Martin: Zika. He convinced his classmates in a service learning course to develop an education and awareness program on the arbovirus Zika. Together, they created an evidence-based, measurable approach that would effectively empower the community to protect themselves from mosquito-borne illnesses. He wrote about the work. The ZBAC catapulted me further into my field of choice at the intersections between public health and laboratory medicine. What I learned about public health is completely congruent with service learning. Partnership, humility, engagement, education, and sustainability. These lessons will continue to guide me in all the work I do. Congratulations, Dr. Konstantin Kanakis. The fourth award is presented to Dr. Aya Owainati. Dr. Owainati will start a pediatrics residency at the Authority Health GME Consortium in Detroit. I will begin with Dr. Owainati's words. Hearing Kyle Mahalo's Student of the Semester speech at Whitecoat, at my Whitecoat, I was inspired to volunteer with player development. It was evident to me that AUC cultivates a culture of service both amongst peers and the local community. Dr. Owainati participated in a set of activities and organizations on campus. She tutored and served as anatomy TA and orientation advisor. She joined the Pediatric Interest Group and the Muslim Students Association. Her work at Player Development opened questions and awareness. Engaging with the children motivated her to learn more about inequalities within healthcare and the impact on patient outcomes. The meaning of adverse childhood experiences and the role of physicians in managing their consequences became more real. She writes, as I look forward to my career as a pediatrician, I am committed to advocate for my patients with the commitment to ensuring that a child's imagination shapes their future rather than their zip code or perceived limitations. Congratulations, Dr. Aya Owainati. And now please join me in congratulating these outstanding graduates of American University of the Caribbean School of Medicine. Enjoy your day, it's your day, and keep well.
Each year, AUC gives the Outstanding Academic Achievement Award to those graduates who have excelled throughout their time at AUC. This year, we are proud to present this award to 2 recipients who have demonstrated an exemplary commitment to the study of medicine while maintaining GPAs above 95.41 during their studies at AUC. I'm very pleased to announce Dr. Alejandro Feria as a recipient of the Outstanding Academic Achievement Award. Dr. Feria graduated in December and will begin his residency at the University of Kentucky College of Medicine, Bowling Green. Dr. Feria is also a recipient of a book scholarship, a MERP Scholarship Award, and a Student Engagement Scholarship. Congratulations, Dr. Feria. I am also very pleased to announce Dr. Hannah Schuett as a recipient of the Outstanding Academic Achievement Award. Dr. Schuett graduated in April, and she will begin her residency in pathology at Cedars-Sinai Medical Center in California. Congratulations, Dr. Schuett. Please join me and the whole AUC family in congratulating both of these outstanding graduates on their remarkable academic achievements throughout medical school. Congratulations.